Good afternoon and welcome to Downing Street for the daily coronavirus briefing. I'm joined by Professor John Newton, our Test and Trace Coordinator. Before I provide an update on the work that we're doing to combat coronavirus, I'd like to update you on the latest figures. In total, 3,681,295 tests have been carried out in the UK, including 109,979 yesterday. 265,227 people have tested positive. That's an increase of 2,004 cases since yesterday. Sadly, of those who've tested positive for coronavirus across all settings, 37,048 people have now died. Yesterday, across the UK, 134 deaths were reported. But for the first time since the 18th of March, I am very encouraged to confirm that yesterday there were no deaths from coronavirus recorded in Northern Ireland. I want to pay tribute to Robin Swan, my opposite number, and all those across the NHS and public health in Northern Ireland and the people of Northern Ireland who have shown such resolve to be able to bend the curve down, and thank them for the work that they've done. While the news may not be this positive every day, I look forward very much to working with them to keep the virus under control in Northern Ireland. Today's figures from the Office for National Statistics show, across the UK as a whole, the lowest number of deaths from coronavirus for 6 weeks. This is a national endeavour, and whatever the headwinds, as a country, we can't let up on this. We're past the peak, we're flattening the curve, we protected the NHS, the number of deaths is falling. We must keep our resolve. And I also want to say a massive thank you to everybody over the bank holiday weekend who stuck to the social distancing rules. And especially to my colleagues in the NHS and in social care who are doing so much. Even though we're past the peak, there are still 8,802 people in hospital with coronavirus in the UK, and there are still 98 NHS colleagues in hospital with coronavirus, including some who are seriously ill. So we must maintain our focus, and there's 2 areas that I'd like to provide an update on today, both incredibly important for the future of tackling this disease: PPE and treatments. First, we've been working hard to build our supplies of personal protective equipment. I know how important this is, especially to colleagues on the front line. We all heard in the early weeks of the crisis the calls from the front line for more and better PPE. And we all saw the global scramble to acquire it. I have been completely open about the scale and the difficulties of this challenge, building a new supply chain from scratch, and of course the operational challenge of delivery. General Sir Nick Carter, Chief of the Defence Staff, said himself this is the single greatest logistical challenge that he'd faced in his 40 years of service. And in response to those challenges, thanks to the armed forces and to so many others, including so many in the NHS, we've seen a mammoth effort. We've ramped up domestic production. I can announce that we have now signed contracts to manufacture 2 billion items of PPE here in the UK. I set a national challenge, and I'm absolutely delighted that Lord Dighton has stepped up and is helping us to deliver against it. Around the world, we've signed deals with over 100 new suppliers, including agreeing contracts for a further 3.7 billion gloves. While we continue to improve the logistics and work hard to get everyone the PPE that they need, these new supplies mean that we're not simply keeping up with demand, we are now able to begin to replenish our stockpiles. There is a lot further to go on PPE, as on so many things, but we have made significant progress, and I'd like to thank everybody involved. And PPE, of course, is so important because it's about protecting the people who protect us. And we'll do that for as long as the virus remains on these shores. The next thing I wanted to update you on is some of the remarkable R&D into treatments that's taking place across the UK. One of Britain's greatest strengths is our life sciences, and in particular our life sciences research. And we're leading the world in the clinical trials that are being done here. As I said at this podium last week, the very nature of scientific inquiry means that not every project will bear fruit. But I'm determined that we'll explore every possible avenue. The recovery trial is the world's largest trial of potential coronavirus treatments. And because our NHS is a universal system in which we're all part of, we have some of the best data and can do some of the best research. Today I can announce that we're beginning a new trial for selected NHS patients of an antiviral drug called remdesivir. There have already been some promising early results on coronavirus patients, with early data suggesting it can shorten recovery time by around 4 days. As you can understand, we'll be prioritising the use of this treatment where it'll provide the greatest benefit. This is probably the biggest step forward in the treatment of coronavirus since the crisis began. These are very early steps, but we're determined to support the science and back the projects that show promise. I'd like to thank the NHS, the MHRA, the devolved administrations, because this is UK-wide, and Gilead, the pharmaceutical company, for their work in making it happen. After all, it's worth remembering that in the battle against this virus, we are all on the same side. So we'll keep working across the world to develop the vaccines and the treatments like this that will help us turn a corner. But until a treatment or a vaccine comes good, there is no simple way to defeat the virus. So we must not lose our resolve. So please, stay alert, control the virus, and save lives. I'll now turn to Professor Newton to take us through the slides.
Thank you very much, Secretary of State. The first slide shows changes in transport use in the country, and the top three refer to motor vehicle transport, cars, light goods vehicles and heavy goods vehicles. And we can see there that there's a small trend upwards in all three, which is more or less what we'd expect, commensurate with the advice that has been given to people to start to return to work. And of course, for heavy goods vehicles, the fact that many businesses have been continuing to deliver essential items to us throughout the lockdown. The slides below show use of public transport, national rail, transport in London, buses and tube, and then buses outside London. And there the trend is really very flat, showing really no increase in the use of public transport recently. The next slide shows numbers of tests and numbers of confirmed cases. And as Secretary of State mentioned, the latest number is 109,000, very nearly 110,000, and a total of 3.6 million tests. The numbers of tests fluctuate, and that's partly because we are sending out large volumes of tests on certain days to perform large-scale population surveys. So the fact that the test numbers fluctuate is to be expected. The graph below shows numbers of confirmed cases, and again, as Secretary of State mentioned, the latest figure is 2004, and that also fluctuates somewhat, but there's a 7-day rolling average trend which is clearly downwards, which is encouraging. It's important to understand that the number 2004 is an underestimate of the total number of cases in the country, because of course not every case that develops is tested or presents for symptoms, but it's a good indication of the overall trend. Turning then to the situation in our hospitals, the first slide shows the number of admissions to hospital with COVID. And there we have a number of 471, which is down from 639. And in fact, that's the lowest number recorded since we started collecting these data on the 20th of March. So that is good news. And within hospital, in our ITU wards, 11% of beds with mechanical ventilators are now occupied by COVID-19 patients. And that again shows a steady downward trend in that proportion. Turning then to people in hospital around the country, we can see the different graphs for the different regions of England and for the different countries of the UK. And a number of things are apparent from this. Firstly, that the impact has been very different in different parts of the country, with a much larger peak in London, also in the North West and the Midlands. But all of these areas show a decline, and so there are fewer people in hospital now in total, 8,802, which is down from 10,118 this time last week. So again, a steady, although slow decline, which is seen all over the country. Sadly, people are still dying from coronavirus, and 134 deaths is the latest figure. This is a relatively low figure compared to previous days if we look at this graph, and we have to bear in mind that there is always a weekend effect and, in the case of this figure, a bank holiday effect. But nevertheless, the 7-day rolling average does show a steady decline in the number of daily deaths. Total deaths recorded with a positive test is now 37,048. We turn to the next slide. We have additional information on deaths from COVID from the Office for National Statistics and from death registrations. And here the number is higher. It's 45,231, which are deaths registered in the UK where COVID-19 was mentioned on the death certificate. So not all of these cases will have had a positive effect. And the figure to compare it with directly is 33,998 on the 15th of May, but those were the numbers of deaths with a positive test. So there is a difference. The graph on the top of the slide shows that gap between the numbers of registered deaths from COVID and the numbers of confirmed deaths. And we can see that the gap is narrowing, but also we can see that there is a bank holiday effect on the numbers of death registrations as well. And the graph below shows, again from Office for National Statistics data, the differences in numbers of deaths by place of death. And this shows the numbers of deaths occurring in hospitals and the numbers in care homes. Both of those are declining. The trend in deaths in care homes occurred rather later and was smaller, but both are now declining. And in total, 28.3% of COVID-related deaths have occurred in care homes. Thank you very much.
Thanks very much indeed. So the first question is from a member of the public. And just to remind everybody, we don't see these questions in advance in the same way that we obviously don't see the questions from journalists in advance. So the first question is from Martin from Brighton and going to be on the video.
Good afternoon. Will the government review all penalty fines imposed on families travelling for childcare purposes during lockdown? Thanks.
Well, thank you, Martin. That's a very good question. And we do understand the impact and the need for making sure that children get adequate childcare. That is one of the significant concerns that we've had all the way through this. And so I think, especially coming from a man of the cloth, I think that is perfectly reasonable to take away that question. I'll have to talk to my Treasury colleagues before I can answer it in full. And we'll look at it. And if we can get your details, we'll make sure that we write to you with a full answer and make an announcement from this podium. I think we can make that commitment. Thank you, Martin. The next question is from Ellie from Kent. And the question is, if people can start to shop for unessential items and kids can go back to school, when we don't know where those people have been, why can't we visit another household who we know have been self-isolating, such as grandparents and partners? And Ellie, this is an incredibly important question, and I entirely understand where you're coming from on this. And one of the most natural instincts is to see people who you know and love. And one of the challenges is that it's very difficult to know where the virus has passed from and to. We are on the 1st of June proposing to make a series of changes, including from the middle of June, starting to open up non-essential retail. And from the 1st of June, having some schools accept children in reception year, all schools accept children in reception year, year 1 and year 6. But as you say, there's also a yearning to see people in another household, and we are looking at how we can make this happen in a safe way. John?
Well, yes, thank you, Secretary of State. I mean, the issue here is all about risk. And we know that if social distancing measures are being implemented well, as they are, I think, very widely in places like supermarkets, then risk is really quite low. But we know the highest risk of transmission is within households. So the people you are most likely to infect are the people in your own household. And so that's why the advice has to be different for meeting people in households compared to other places. But the gradual increase in contact is what will get us all back to normal. But we do have to bear in mind that everything we do has risk attached to it, and the objective is to reduce that risk as much as possible.
Fantastic. Thank you very much, Ellie. Next question is from Laura Koonsberg of the BBC. Laura.
Thank you very much, Health Secretary. Nearly 40 of your colleagues believe that the Prime Minister's top advisor let the country down and want him gone. Given that you stood there at that lectern and told people the guidelines weren't advice, they were instructions, do you feel that way, or at least see why your colleagues do too?
Well, thank you, Laura. On this question, Mr. Cummings has set out all of the details in quite extensive detail yesterday, and then invited questions on it. My view is that what he did was within the guidelines. I can understand why reasonable people can take a different view, but my judgment, which is the same as the Prime Minister's judgment, is that what Mr. Cummings did was within the guidelines. After all, the guidelines allow for exceptional circumstances, particularly with regard to childcare. And if you are, and we've stated before that if you're unable to look after a small child, that is an exceptional circumstance. So I think that within the guidelines, Mr. Cummings acted, and the most important thing is that we can get on and deal with the other issues, for instance, those that I've talked about today on PPE and on treatments.
But, Health Secretary, do you admit that it's doing damage to the government's credibility and maybe undermining the message? I mean, you've just there at that lectern said, after a question from a member of the public, that you might review some of the fines that have been given to people if they were travelling for reasons to do with their children. This is making a difference, is it not, to what you're trying to do in government? No,
I actually think that it's incredibly important that people keep their resolve. As we can see from the falling number of deaths, the falling number of hospital admissions, and as we stand up the increased test and trace capability, I think it's incredibly important that as a nation we keep our resolve. Everybody has a part to play in this, and everybody needs to act in a way that's responsible both for them and for their community. I think that I do think that's important, and I think it's important that we all stick at it. Thanks very much. Robert Peston from ITV.
Secretary of State, you and your wife tested positive for COVID-19. You have 3 young children, but you chose to stay at home in London. What is the relevant difference between you and Dominic Cummings?
The relevant difference, Robert, is that we had childcare readily available at home and Mr. Cummings didn't. Thanks very much. Ben Kentish from LBC.
Thank you, Secretary of State. Health Secretary, 71% of people disagree with you and the Prime Minister. They think Dominic Cummings did break the rules, and because of that, confidence in the government has plummeted 20 points in just 4 days. Given how important that confidence is to pretty much everything you're trying to do, from maintaining social distancing to reopening the economy and getting people back to work, and the track and trace system that you're introducing next week, how much does that apparent loss of people's confidence worry you? And what do you say to those who say simply, that means you are risking people's health and the health of the economy, all people think, to save one number 10 advisor? What would you say to them?
Well, of course, I understand the anger that some people feel, and I regret the anger that some people feel. And Mr. Cummings himself said that with hindsight, he should have got all these the facts out earlier. What I say is that it's incredibly important that as a country we focus on what we need to do now. And I've said this repeatedly through this crisis. You've got to wake up every day and work out what is the best thing to do next, and making sure, for instance, that we have the PPE available and that we protect people on the front line, making progress on these treatments, as I talked about. These are the critical next steps that we need to take, along with, as you said, making changes to the social distancing rules to allow people to get back to doing some of the things that they love. If you look at the earlier question from Ellie from Kent, it's all about how do we get back to a position where I can see my loved ones. These are the sorts of things that the country is yearning for, and I'm not underplaying the importance of the debate that there's been, and as I've said, entirely reasonable that reasonable people can disagree with the over what happened over the description of what happened over the weekend. But I'm here to focus on and really drive forward all of the other important things that we need to do as well. Thanks very much. Seb Payne from the FT.
Thank you very much, Mr. Hancock. Mr. Hancock, as we've just heard, according to a poll conducted today after that press conference, 71% of the public said after hearing Mr. Cummings' versions of the events, they believe his drive to Durham broke the lockdown rules. You've just said that it didn't. Are you saying that 71% of the British public misunderstood those rules? And if so, does that mean you as a government have failed drafting them? And also, if you don't mind me asking, would you now advise Britons to use that discretion on interpreting the rules, or is that discretion just for people who work in Downing Street? Thank you.
As I've said, it is incredibly important that people follow the guidelines. I was actually standing at this podium when the DCMO set out that clearly, as she put it, clearly if you have adults who are unable to look after a small child, that is an exceptional circumstance. And the guidelines were drafted with exceptional circumstances in mind. There were other exceptional circumstances that are set out that don't apply in this case, but describe some of the other exceptional circumstances that people face. Therefore, I think it is reasonable to conclude that the description of events that Mr. Cummings put out yesterday was within the guidelines. But I also, as I've said in answer, I think, to the first question, I do think that I understand that reasonable people will disagree with that, and of course I understand some of the anger that boiled up over the weekend. Thanks very much. Joe Murphy from the Evening Standard. Joe.
Secretary of State, on Monday there's going to be a major landmark with the beginning of Test and Trace, which will hopefully help beat this virus while reopening the economy. Professor Newton, as a noted epidemiologist, how important is it to the success of this great project that people obey the instructions they're given by contact tracers to the letter and to the spirit? Can they, for example, follow their instincts to interpret this guidance?
Well, if I answer first and then I'll hand over to Professor Newton, the NHS Test and Trace programme is going to be incredibly important because, as the Evening Standard itself has set out, the whole purpose here is to try to move to a system where we have a more targeted lockdown, where if you're at high risk because you've been in contact with somebody who's tested positive, you're asked to self-isolate. And also it will give us the information to have local lockdowns and focus on areas where there may be flare-ups. And it is very important that people follow those rules. And they should do it, not do it for the government. People need to do this for themselves, for their loved ones, for their communities. It's incredibly important, and it will stop those local flare-ups from happening. John.
Thank you, Secretary of State. Yes, so the Test and Trace programme is a very important contribution. It will allow us to control the virus in a different phase of the pandemic while we are returning back to normal. But it's important to stress that it has to be seen alongside other measures, such as continued social distancing wherever we can, and also basic hygiene, and all those things will contribute. Because we know that no country in the world that adopts test and trace, we will not be able to find every case, and we will not be able to trace every contact. But to your point, the programme will give contacts very clear instructions. They will be phrased as instructions rather than advice, and we do expect people to follow them. Thank you.
Thanks.
Mr. Hancock,
yes,
you're going to be asking families to isolate for 2 weeks on the say-so of an official, even if they don't have symptoms. Can you make that big ask if the people who are writing the orders aren't following them?
Well, as I said, Joe, I think that it is incredibly important that people play their part in the test and trace system. It will be somebody from the NHS. These are all signed off by the NHS. So people are doing this. You know, they're not doing it for me. People are doing this for their loved ones. If you're phoned up and asked to self-isolate, even though you're perfectly healthy, because you've been in close contact with somebody who's tested positive, then it's your civic duty to then self-isolate for yourself, for your community, for your family. And we all need to come together to do this, and that will then in turn allow us to lift some of the measures that currently are blanket measures across the whole of society and have to be blanket measures until we have the NHS test and trace system up and running and in place. So it is very important, and we're asking people to do this for their community and to ensure that there aren't those local flare-ups that would then require us to take more specific targeted action across a whole area, for instance, across a whole town. Thanks very much. Finally, Phil Coleman from the News and Star. We've lost Phil. Yes, Phil.
Good afternoon, Secretary of State and Professor Newton. As we've heard already this afternoon, the impact of coronavirus has varied considerably across the UK, with Cumbria among the hardest hit areas. Yet local health leaders, despite us appearing to be past the first peak, genuinely fear a second wave of infections and deaths, potentially fueled by visitors flooding back to our county, primarily the Lake District, which last year saw 47 million visitors in a county whose health system is designed for 500,000. So what tools will you give our local officials, the police, public health officials and the like, to manage any future flare-ups? And might those tools include the option of a temporary, localised or regional lockdown? And secondly, you've already mentioned, Mr. Hancock, the vital importance of PPE, how it protects the people who protect us. Sadly, in Cumbria, there have been examples of frontline NHS staff who have worked with PPE masks which were not properly fit tested for a number of weeks, potentially putting those workers at risk. So what's your message to those staff, and how will you ensure that they don't face that risk again in the future?
Thanks, Phil. I'll have a go at the second question and then pass to John for the first. On PPE, we have had some problems of items that were in the stockpile and were put in the stockpile some time ago, that then we discovered on second checking them that they didn't fit the requirements, and we then withdrew those, and we acted as fast as we could as soon as we knew that there was a problem, and we've done the very best we can to tackle that. I'm advised that the clinicians consider that the risk was low because of especially the particular item that you mentioned, and these were only for use in low risk settings. Nevertheless, I know how important it is to get the right PPE, and so as soon as we found out about the problem, we put a stop to them going out of the warehouse, and we let the system know that there was a problem with these items. So what I'd say to staff on the front line...
Sorry, Secretary.
Yes, of course.
Apologies. The problem here wasn't so much the kit that was of adequate quality. It was the delay in training or in in fit testing the people who wore that kit to ensure that that kit was properly airtight. Therefore, it appears to have been a systemic problem, not a problem with the actual kit. So, again, systems failed, not kit.
Right. Well, look, I know that there were some problems with that as well at the start. I hope we've resolved them now. It was all part of, going from needing normal amounts of PPE to needing very high amounts of PPE. And I will personally make sure that the specific example that you raise is looked into. And why don't we speak again once I've been able to look into it and get you a full answer. On the second point, I know that there's been a specific problem in terms of flare-ups and in terms of the number of cases, particularly in Barrow-in-Furness. And I've been talking to the local MP about this, who's doing a brilliant job in bringing matters to my attention locally. And the short answer is yes, we will have local lockdowns in future where there are flare-ups. And we have a system that we're putting in place with a combination of Public Health England and the new Joint Biosecurity Centre, along with the local directors of public health who play an absolutely crucial role in the decision-making in this system, to make sure if there is a local flare-up, we have a local lockdown. So local lockdowns will be part of the future system that we put in place as part of the NHS test and trace system. And that's the short answer. Professor Newton can give you the long answer.
Well, it's a pretty good answer. I think your question is a really good one because it emphasises the fact that whatever measures we put in place have to work everywhere in the country, and all different areas will have their own different considerations. The Lake District is a very special place. It has a lot of visitors, has a lot of open spaces, and it's difficult to reach parts of it. But other parts of the country have different challenges. So the measures we're putting in place are a mixture of national resources. The test and trace programme is unprecedented in its scale, but works on the basis of well-tried principles of public health contact tracing. It's supported by technology, a web-based function, but also, as people will know, there is an app in trial in the Isle of Wight as well. So there's a national resource. There's a regional resource in the Public Health England's health protection teams are available, and they are working, I know, already with colleagues in Cumbria on the issue that Secretary of State mentioned. And then we have the local resources. We have local directors of public health, but actually the whole of civic society needs to be involved in coronavirus. We're all affected by it, and in fact, many different organisations will be involved in helping us to respond to it, whether that's in local councils who help with infection control, but also in supporting people who might be self-isolating, and many other local businesses who will need to use social distancing to prevent infection, but also to respond when their employees are asked to self-isolate and support them. So it is a whole country effort. It has a national component, but it has a very important local component as well, which needs to reflect the things that you described, the special characteristics of different parts of the country. Thank you.
Thanks very much. Was Professor Newton's answer good enough for you?
Thank you.
Thanks very much indeed. That concludes the Coronavirus Daily Briefing. Thanks very much indeed.